It is National Midwifery Week.
So the president of Frontier Nursing University, Dr. Brooke Flinders, joins us now to tell us more about midwifery and to let us know and just check some of our facts. So first, thank you so much for being here and educating some of us who don't know exactly what a midwife does. So can you kind of tell us, before we jump into Frontier Nursing, tell us what a midwife is?
Sure. So midwives, of course, care about pregnancy and childbirth. That's what we're known for. But midwives also provide primary care. They care for women throughout the lifespan, so adolescence all the way through menopause and beyond. And so we do provide care in hospital settings, in clinical-based settings, and community settings. And midwives have been around for years and years.
So can a midwife replace a traditional nurse? How does that work?
Yeah, so midwives are advanced practice registered nurses. So they're nurses who have additional education, and you may be familiar with family nurse practitioners or women's health nurse practitioners. There are all sorts of different specialties at the master's level, and nurse midwives is one of those specialties.
That's one of them. So Frontier, you've got all kinds of programs, and you can really hook somebody up, can't you?
That's right.
So let's talk about that.
That's right. So Frontier's been around for about 100 years. We have the nurse midwifery program. We have family nurse practitioner, psych mental health, and we also have a doctor of nursing practice program.
And the wonderful thing about Frontier is that you all do a lot of classes online, but you also see in person as well, right?
That's right. It's a pretty unique model, and students come to campus for, we call them bounds. So it's before they start their education, they come and they meet their faculty, they meet their peers, they meet the staff, and then they do the programs from their homes in their own communities where they continue to practice as nurses, and they're able to learn right in their home communities.
It seems like there is such a need for, midwives and nurses now. Are you seeing an increase in registration?
I think so. I think that, our program, we have altogether about 2,500 to 2,700 students at Frontier right here in Kentucky, and we graduate about 40% of the midwives across the country.
40% across the country.
That's a large number.
That is incredible. I mean, that's the bulk of it right there.
Yeah.
I mean, it really is. So if someone's seeking some information, maybe they're wanting to dip their toe in to find out more. How can they go about it?
You can either go to the Frontier webpage, or we also have, I believe, posted that people can see. It's midwivesofkentucky.com for more information.
And you're new here, right? Just got here in August.
New here.
But you knew this program was fantastic and you wanted to be a part of it, right?
That's right. So I did my actual graduate degree at Frontier years ago, and I became a nurse midwife there, and I came back to Frontier for my DNP, and as soon as an opportunity came up for me to come back and lead at Frontier, I took the opportunity.
Dr. Brooke came from Cincinnati, so
sure did.
Just to let you know, Dr. Brooke is amazing.
She did.
Throwing that out there.
Clearly. All right, now you've got, you wanted to get a little interactive with us, so you've got a little true-false game. So India and I have these true, I'm going to figure it out. So we'll have to, I'm still upside down. All right, so she's going to ask us, and we're going to see how smart we are. All right, you ready?
I'm ready.
You ready?
All right,
Okay,
let's do
here's
it.
the first question. True or false? Nurse midwives only focus on pregnancy and birth.
It's false.
All right, you're both correct.
That's
right. Midwives did attend about 11% of all births in the United States in the past year, but they also provide annual exams, and as I said before, we care for women throughout the lifespan.
See, she addressed that in the very beginning.
Yeah.
I was listening. I know.
All right, you ready?
Yes.
All right, the next one, most births attended by nurse midwives are in hospitals.
No.
You're both correct. More than 90% of the births attended by certified nurse midwives occur in hospital settings. Both correct. All right, there's one more question. You ready?
I'm ready. I'm ready.
You cannot get an epidural if you use a certified nurse midwife. True or false?
That you can't get it?
You cannot get an epidural if you use a nurse midwife.
No, I don't. I think you can. I don't know. So I'm saying that's false, that you can.
You're both correct again.
Oh, see?
Both got 100%.
Oh,
that is true. Nurse midwives are leading experts on natural childbirth, but you can also get an epidural or other medication if you choose to during childbirth.
You know what I've also noticed? A lot of women, too, are opting out of an epidural and looking for more of that natural route.
Yeah.
It makes me so nervous. I know I had a child. I did get an epidural. But having a child natural just makes me so nervous. But you make people feel comfortable with having a child naturally. Can you tell us a little bit more?
Sure. So basically, I would say that midwives start that discussion early on in a pregnancy. And so if that's what a woman wants, then we have a lot of tools. And you know, and we work with staff nurses, and we work with doulas, and we make sure that people feel supported so that they can get you know, through one contraction at a time, and so they can have the birth that they want.
Oh, that makes
It's not for everybody.
It is.
Right, you're right. It's not.
I would be asking for the epidural all day, y'all. So I'm so glad to know that you all are able to produce that as well.
Absolutely.
And you can check out more information and maybe find find your career, maybe find your next level of education right there with Frontier.
Right.
Frontier.edu. Thank you so much for being here.
Much.
And welcome to Kentucky.
Thank you.
Yes.
Much better than Cincinnati. We're so glad to have you.